This video was produced to prepare physiotherapists for the interviews on stratified care in Nigeria. It is the second of a two-part video focusing on research evidence and benefits of the start-back approach, beginning with a short reflection from part 1. It is a collaboratory effort from the Trier University of Applied Sciences, Germany, the University of Lübeck, Germany, and the Obafemi Awolowo University in Nigeria. The start-back approach in this video was developed in the School of Medicine, Keele University, UK. This video was designed to introduce the start-back approach to low back pain, describe its supporting evidence from research, and outline the benefits of the start-back approach. The start-back approach involves grouping patients into categories based on the likelihood of poor treatment outcome and targeting them to specific evidence-based treatments. In the start-back approach, all individuals visiting the clinician with varying forms of non-specific low back pain are first screened using the 9-item start-back questionnaire. The score determines the subgroup classification. Depending on the subgroup an individual falls into, there are matched treatment recommendations. Patients are matched with treatment based on these recommendations. For low risk, advice and pain medication. Medium risk, physiotherapy and self-management. For high risk, physical and psychological approach. The treatment principle involves giving basic examination and advice to all three subgroups. While the medium risk group receives evidence-based physiotherapy, the high-risk subgroup receives psychologically informed therapy in addition. Matched treatments for low-risk category. Patients receive minimal care aimed at reducing pain and disability and to ensure self-care. This includes a 30-minute consultation session where examination and history will be taken to rule out red flags. Patients will then be reassured, advised on self-care, and advised on exercises to help pain and disability. Patients will then be discharged with or without medication. Medium-risk patients, in addition to the treatment for low risk, will be given minimal care described above and additional physiotherapy. This will include a slightly longer assessment of 45 minutes with up to 6 sessions of 30 minutes physiotherapy for 3 months. The high-risk category will involve minimal care, physiotherapy treatment, and psychologically informed therapy aimed to induce physical and psychological recovery. This will include a slightly longer assessment period of 60 minutes involving biopsychosocial assessment and up to 6 sessions of 45 minutes physiotherapy for 3 months. The high-risk intervention combines physical and psychological approaches. Psychological factors such as hypervigilance and fear avoidance will be combated using enhanced communication skills. Unhelpful beliefs and pain behaviors will be challenged to dispute them. Negative emotions, worry or depression will be tackled using techniques such as pacing, distraction, interoception, and graded activities. Unrealistic expectations will be reshaped using a patient-centered approach. The benefits of this approach has been seen in research. In 2 UK studies, this approach was shown to reduce patients' need for medication, reduce referral for physiotherapy, and improve patient outcome. Regarding cost savings, the use of this approach resulted in the saving of about £34. This was due to the use of less medications, less referrals, less tests, and others. The start-back approach has also been used in more countries and has shown through research to be more effective and efficient when compared with current treatment approaches. It is described as best practice in the UK Clinical Guideline for Treatment of Low Back Pain. Summarily, the start-back approach uses the start-back questionnaire and is matched treatment. Patients with non-specific low back pain are grouped based on risk of poor outcome into 3 subgroups. Research has shown that this approach is efficient and improves patient outcome. The Start Back approach is evidence-based and has been recommended by the UK Guideline for Treatment of Non-Specific Low Back Pain.